When I first walked into an orthodontic clinic, I didn't notice the wires or the drills, not even the chairs that look like they're one remote button from launching someone into space. I noticed the walls, photo after photo, wide, gleaming smiles, not just straight teeth, but straight backs, lifted confidence, unrestrained laughter. And I remember thinking, wow, a smile can change someone's entire posture towards life. Maybe that's why I noticed it so much as well, because I knew what it felt like to hide mine. Before braces, my teeth were crowded and uneven, and I used to keep my mouth shut in photos. When they were finally fixed, it wasn't vanity, it was freedom. That small change shifted how I carried myself, how I spoke, how I showed up. It taught me super early that dental care isn't just cosmetic. It's confidence, it's an opportunity. We think of smiles as small, universal, casual, but I learned early that they're anything but simple. A smile can be an inheritance, a cultural script, a marker of belonging, a quiet shield. And it can be a mirror into the world that we've built and who that world serves. Growing up, smiles were heirlooms in my family, not born from wealth, but from change. My parents left a stable life in Korea to start over in America, trading comfort for possibility and opportunities for their children. Their smiles carry determination and quiet sacrifice, the kind that builds a new foundation from unfamiliar ground. And I began to see how what we inherit isn't always material. Sometimes it's resilience shaped by circumstance. But when I chose a path to dentistry, I realized something. Smiles carry power, and power is unevenly inherited. That realization stayed with me until I began to see how, for others, inheritance could look very different. This past summer, I joined a medical caravan in rural Guatemala. The city, Huehuetenango, where we set up temporary clinics, has a high poverty rate, estimated at about 84%, being among the poorest departments in Guatemala. We've traveled to regions where there are no clinics with x-rays across 23 towns. Every day for a week, we took about 80 patients. Countless children came in with baby and adult teeth blackened with decay. A man arrived with exposed nerves, unable to sleep or eat without pain. Young mothers, not careless but stretched thin, struggled to understand instructions, not out of apathy, but exhaustion and necessity. And yet, they smiled. Not because their smiles were untouched, but because someone was helping them eat without pain. It struck me. Some people inherit dental disease, not through genetics, but through geography, poverty, and survival. Pain can be passed down when prevention is never within reach. It sounds so simple. We all know poverty affects health, but witnessing it through a mouth, a smile, a child in pain made it visceral. Then in Newark, New Jersey, where nearly a quarter of residents live below the poverty line, I worked on endodontic research with residents. These are dentists who will go on to specialize in the pulp and root canals. I saw patients living in pain for months because Medicaid coverage is limited and transportation isn't reliable. Parents working 2 jobs, choosing between childcare, rent, and a dental appointment. I remember one father raising kids alone in a new country whose elementary-age kid needed a root canal. Root canals in children are rare, except in communities where survival is fragile. A couple of patients told me they were using THC for pain. This was not done recreationally, but because opioids terrified them and dental access felt impossible. These were not non-compliant patients. These were people navigating a system never built for them. For many, the only thing that they've inherited from those systems is avoidance. The idea that care is something meant for others. Contrast that with suburban Old Bridge, New Jersey, where I once worked at an orthodontic clinic. Tree-lined streets, braces before middle school, whitening before prom. Dental care there isn't crisis management. it's optimization. Confidence is curated early because it can be purchased early. It became clear to me that some people inherit healthy smiles while others inherit early intervention. And those inheritances are not random whatsoever. They map perfectly onto inequality. Smiles follow socioeconomic lines long before braces ever do. Smiles are biological, yes, but they're also cultural, clearly, and systemic. Where my family is from, South Korea, people brush their teeth after every meal. Dental care is affordable, preventative visits are routine, and because care is accessible, I personally noticed a greater emphasis on comfort. Doctors making procedures painless, offices cheerful, even cute, and patients picking and choosing practices based on the staff and building's aesthetics because they can. In American culture, we often inherit something else: silence, shame, avoidance, the idea that dental care is a luxury, not healthcare. Some families inherit habits of health, others inherit barriers to it, and those too shape the smiles that we pass down. But inheritance runs deeper than culture. It lives in cells, in stress, in memory itself. Science reminds us that heirlooms aren't only visible. We now know that trauma and stress echo across generations through epigenetics, behavior, access, and fear. Oral health and brain health are intertwined. Chronic inflammation from gum disease correlates with cognitive health, mental health affects oral health, and oral pain fuels anxiety and depression, creating a cycle the body remembers even when systems forget. Some inheritance is genetic, some is cultural, some is systemic, and some is silent biological memory. People say our generation, Gen Z, is the one breaking cycles, and I believe that. We are learning to question what we inherit, whether it's stigma around mental health, silence around struggle, or inequities in healthcare. But breaking cycles doesn't mean blaming those who inherited the fewest resources. It means refusing to pass inequity forward. Not every heirloom is a gift, but every heirloom can be transformed. So, what do? We don't solve this by telling people to just take better care of their teeth. That's not advice, that's punishment disguised as guidance. We build preventative dental access in schools and shelters, dental programs in rural and immigrant communities, policy that treats oral health as essential health care, cultures where confidence is not a privilege. We rebel by creating systems where dignity is shared, where smiles aren't gatekept by income or geography, because the goal is not perfect teeth. The goal is freedom to smile without pain, without shame, without hesitation. So I ask you, what kind of smile did you inherit? Guarded or open, silent or empowered, and more importantly, what kind of smile will you pass down? Because heirlooms are not only what we keep, they're what we choose to transform. If a smile is an heirloom, let's make it one that is accessible, dignified, confident, and free. Not because we have to smile, but because finally we can. Thank you.